Good evening, my name is Melissa Campbell and I am doing my TED Talk on skill retention in nursing. The agenda for this TED Talk will be key factors affecting nursing skill retention, strategies to improve skill retention, research and evidence, retention programs, and skill retention impact. Nursing skill retention can be defined as and refers to the ability of nurses to maintain clinical knowledge, skills, and competencies over time, especially after their initial training or infrequent use of skills. This is a critical issue in healthcare because skill decline can impact patient safety and the quality of care that we are providing to our patients. Key factors affecting nursing skill retention that we'll talk about is the frequency of use of this skill, the training method that was provided behind this skill, experience level of the nurse, time since the nurse has last used this skill, and then reinforcement and feedback. Looking at these key factors affecting nursing skill retention, we'll start off with the frequency of use. Skills used regularly are retained better. Rarely used or emergency procedures, example code blue response, intubation support, tend to decay faster. Training methods, simulation-based learning, and hands-on practice result in a better long-term retention than passive learning. Passive learning would be lectures, PowerPoints, handouts. The experience level of the nurse. Novice nurses are more susceptible to skill decay than experienced nurses. Time since last use, skills can begin to decline in as little as 6 months without practice. Some studies have shown even within 3 months, some skills can start to decay. Reinforcement and feedback. Regular feedback and refresher courses help solidify the nurse's knowledge and correct mistakes before they become habits. Strategies to improve skill retention. Regular refresher training. This includes periodic workshops, simulations, competency assessments. Simulation-based training. We have high fidelity simulators that can improve confidence and retention of critical skills in a low stress environment. Weekly skills training. This can be brief, it can be focused training sessions, performing a rarely used skill. Mentorship and peer learning. We want to encourage learning from more experienced colleagues. Research and evidence. Studies show that deliberate practice or spaced repetition significantly improves skill retention in clinical settings. For example, CPR skills can deteriorate within 3 to 6 months without practice. Simulation training with quarterly refreshers leads to better long-term performance in emergency scenarios. Nursing skill retention programs. These include structured interventions that are designed to maintain and enhance nurses' clinical competencies over time. Simulation-based retention programs. The purpose of these are to reinforce technical and critical thinking skills in a realistic, risk-free environment. Different components of these include high-fidelity simulators for scenarios like code blue, sepsis management, or airway emergencies. They say that these should be scheduled practice every 3 to 6 months, and these should be followed by debriefing sessions for reflections and feedback. An example of a simulation-based retention program would include a hospital running quarterly mock codes with immediate performance feedback and peer coaching. Weekly skills training. Deliver training immediately before a nurse performs an infrequent procedure. This can also be called just-in-time training. This can be short videos or hands-on refresher training, mobile access to guides or checklists, and this can even be integrated into the workflow, QR codes near equipment that is not frequently used. So an example would be before a catheter insertion, a nurse watches a 2-minute refresher video at the workstation and then goes and performs the skill. Competency validation programs. The purpose of this is to regularly assess and verify a nurse's skills to ensure patient safety and safe practice. Components of this include annual or semi-annual skills checkoffs, the objective checklist, and standardized evaluators. This can be tailored based on the unit's needs, OR, ICU, med-surg. An example of this would be a nursing education team tests IV medication administration and wound care yearly using standardized patients. Peer-led skills labs. This is used to foster a low-pressure environment for skills practice with guidance. The components of this include a nurse educator or advanced clinician that leads small groups. They would focus on risky or high-risk skills. They could hold open lab hours or scheduled sessions. So an example of this would be monthly drop-in skills lab for insertion of NG tubes, using ventilators, etc. And then lastly, we have cross-training and rotations. The purpose of this is to broaden exposure to different clinical areas and increase skill diversity. And components of this would include rotation between different departments. An example would be a med-surg nurse going down to the ICU or to the ER. This could also include temporary assignments to a specialty unit, and then this would need to be supported by mentoring and structured learning objectives. An example of this would be a med-surg nurse spends 2 weeks yearly in the emergency department to retain triage and rapid assessment skills. Metrics for evaluating the effectiveness of nursing skill retention. We can look at clinical performance matrix. An example that's on the slide is skill checkoff pass rates, percentage of nurses passing competencies assessment on the first attempt. Other examples would be error rates and targeted skills. Example, medication administration errors, central line infections. Time to task completion, time to initiate CPR, administer antibiotics for sepsis. Simulation performance scores, objective scoring from high fidelity simulation scenarios. And then procedure success rates. An example of this would be IV insertion, success on the first attempt, Foley catheter placement, accuracy. Number 2, knowledge retention metrics. This will track the nurse's ability to retain theoretical and practical knowledge over time. It could be used as pre-post test scores, measure knowledge before and after training refreshers, delayed retention tests, ASEX, knowledge 3 to 6 months after training. Program engagement metrics, percent of nurses eligible who complete scheduled skill lab or simulation, completion rates or refresher modules. We can also look at time spent and training activities. We can track this, their time spent in simulations. And then we can track nurses who voluntarily return for practice outside of mandatory sessions. Number 4, staff confidence and satisfaction. Gauge the perception of the readiness and confidence of the clinical practice. This can be done on a few levels. Self-reported confidence levels, collecting surveys before and after the skill refresher, program satisfaction scores, rating on program usefulness, the realism, accessibility, etc. And then also we can look at the perceived impact on patient care, survey them. Did this program help provide safer patient care? And then patient safety and quality metrics. We can look at adverse event rates, falls, pressure ulcers, infections, rapid response, activation trends, more timely or effective use of rapid response teams. We can also collect patient satisfaction surveys, And we can use all of this to correlate improvement in skills retention with actual patient outcomes. And then long-term retention outcomes. This is useful for evaluating overall program sustainability and value. We can look at the skill decay rates, compare performance 3, 6, 12 months after initial training. We can also look at staff turnover rates. Retention programs may improve morale and reduce the staff turnover. Performance improvement over time. We can trend this across cohorts to see if there's consistent gains in core skills. So navigating key performance indicators, I've listed 9 indicators that we can use. So we can look at simulation performance scores. We would want to set a benchmark greater than or equal to 85% of the average score. We could look at IV insertion success rate on the first attempt. We would want to set a benchmark ideally at greater than or equal to 90%. Looking at the central line infection rate, we could do less than or equal to 1 per 1,000 catheter days. For post-training scores, we can set a benchmark at greater than or equal to 90%. Looking at 3-month delayed knowledge retention scores, we can set a benchmark at greater than or equal to 85% correct. Looking at training participation rates, we can set a benchmark at greater than or equal to 95% of eligible staff. And then looking at fall rate per 1,000 patient days, we can set a benchmark at greater than or equal to 2. Staff turnover rate, we can set a benchmark at greater than or less than or equal to 10% annual. And then skill decay, 6-month performance drop, we can look at less than or equal to 10% of decline in performance. Now, these are just some key performance indicators. There's many more, and the benchmarks can be adjusted to your effective patient population and your staff skill level as well. So looking at nursing skill retention impact, if we look at positive impacts and we speak about fewer medical errors, well-retained skills reduce risk like medication, misadministration, improper wound care, or procedure errors. Improved emergency responses, rapid and effective responses in CPR, code blues, or stroke alerts increase survival rate and reduce complications. Lower infection rates, consistent catheter care, sterile technique, hand hygiene directly reduces the CAUTI and the CLASP. Looking at better chronic disease management, nurses who retain assessment and teaching skills support better patient adherence and health literacy. Then looking at, this kind of refers to staff confidence, morale, and retention, the positive impacts of skill retention, higher confidence levels. Nurses who feel competent are more likely to take initiative and make clinical decisions. Reduced burnout, skill mastery reduces anxiety, especially in high acuity or high pace settings. Lower turnover, investing in continued skill development increases job satisfaction and retention. And then increased peer support. Ongoing skill and development encourages teamwork and collaboration. Looking at from the organized performance, positive impacts, improved accreditation readiness, regular skill validation support, compliance with Joint Commission, reducing liability. Fewer errors means lower legal and insurance risk for the hospital and for the nursing staff. Cost savings, preventing adverse events, pressure ulcers, readmissions can save hospitals thousands per incident. And then lastly, efficiency, retained skills lead to faster, more accurate interventions, especially in high volume areas like the ED and the ICU. Not mentioned on here is the educational return on investment. Hospitals using simulation-based skill refreshers have shown up to 50% improvement in Code Blue responses. Studies also show medication error rates drop by 30 to 40% when nurses complete regular pharmacological refreshers. Institutions report reduced orientation times for cross-training and float nurses, saving on training costs. These are the references that I use for my PowerPoints. And I just want to thank you guys for listening to my TED Talk.